morning we're going to do our regular employee benefits meeting, running through some changes for 2026. Hopefully you've heard that we do have a slightly new healthcare plan with United Healthcare. We'll run through any of those changes, recap all of our benefits programs. John Hastings is our broker for the township, and then Derek is working on our account with us. Really helpful in a lot of different things. So thanks to them for being here, and I'll let you guys get started.
Thanks, Ben. Well, I haven't been by the firehouse in a while, and I can't believe how much construction's going on behind you guys.
Oh, boy.
Something else. All right, so a lot of slides, but we're going to go through this fairly quickly. Stop and ask me questions as we go along the way, as Ben mentioned. So I guess the good news is there's not much change to talk about. So it's going to be a fairly quick overview. One thing that did change is that United Healthcare essentially stopped the plan that you've had the last couple of years. So they did away with that plan. So there is a new plan in place, however, extremely similar to what you had previously. And again, coming up from open enrollment, as I mentioned, the 12th through the 22nd. So if you want to make changes to plan, add dependents, take them off, anything like that, pick up or drop coverages, that's going to be the time to do that as well. So again, overview, United Healthcare, still the same carrier. OptumRx, medical, iSolved is your HRA, and wellness is through WellWorks as well. So everything, again, not a lot of change there, and that's what I'm going to say a number of times. So here's the new plan. I'm not going to talk about out-of-network, because United Healthcare, very large network, so we'll talk about in-network. So same, essentially 5,000, 10,000, 100% coinsurance. So you have, unlike last year where you had co-pays for essentially every type of service that you were doing for inpatient or anything like that, this year the co-pay, that type of plan is no longer. So they've done away with that plan. This is more along the lines of a traditional plan where you have your deductible. So if you have inpatient, things like that, you're going to have those costs go towards your deductible. And then once you hit your deductible, it's covered at 100%. There is an additional, you see the out-of-pocket maximum there, the $6,350 for individual and the $12,700 for family. So there is an individual deductible embedded in the family deductible. So you're not going to have as one person hitting $12,700 in a family plan. You just be responsible for that individual deductible. But once you hit your deductible and during that, any co-pays that you have, you still have normal co-pays for your primary care physician, specialists, things like that. That's going to go towards that differential between your 5,000 individual and the 6,350, so that 1,350, that's where your co-pays are going to go. So if you hit your deductible, you're still going to have co-pays until you hit that 6,350 from that perspective. If you are remembering, you have your wellness program that you can do the wellness credits and pick up 1,000 or 2,000 based on if you're individual or family plan, and then coverages through the Township's HRA that picks up after that portion as well. And not all of your co-pays on the pharmacy side are picked up, but there is a portion of those that are picked up that you can get reimbursed for as well through the HRA program. So again, the big difference is it's more of a traditional plan where you have your normal deductible for most part, and then you hit that, you have your out-of-pocket with it, again, it's just going to be co-pays as it's 100% coinsurance once you hit your deductible. Any questions on that? And again, this is the biggest change for this year. No change on networks or anything like that, no change on the pharmacy. Pretty much as close as possible to your plan previously from that standpoint. You're gonna.
One of the other big changes is there used to be that designated network, and there's no longer that designated network. It's all just in-network or out-of-network. So you don't get like the special rates for having the designated network or whatever. It's just you're in or you're out. So it's simpler that way.
That's a great point, Derek. So if you remember last year, you had it's a little almost a narrowed network where your copay would be a little bit less. And then if you went to the broader United Healthcare network, you had a slightly higher copay. They've done away with that across the board for all of their plans. So now it's just anywhere in the network, in the UHC network, is the same copay. You're not going to have that variation of copays between the different plans. Just as a reminder, you have your pre-annual physicals. Those are still covered at 100%. Your colonoscopies, your mammograms, your physicals. And as a reminder, I'll use colonoscopies because that's a good example. If you go in and they find something or they do a biopsy and you get a bill for that, and you thought it was your preventative and why are they charging you? Anytime they find something or do a biopsy or they're following something that they think might be wrong that happened during that goes from preventative to diagnostic. And once that happens, then it gets moved from preventative wellness to your deductible. And it happens for that, and then moving forward, if you go again your next year for your next colonoscopy, for example, now it's diagnostic, it's no longer preventative. So it would go towards your deductible versus your free annual physical. I think that's really about most of the changes that for this plan. It's just the difference in the copays. You can see your emergency room visits. Again, I think the last plan was a $750 copay. Again, this is more along lines of a traditional emergency room visit for the $300 copay with regards to that. Obviously, emergency room, don't use it unless you have to. But obviously, if you need to use it, certainly use it. Again, prescriptions, as we talked about, there is a reimbursement that you can get on some of your copays on the prescriptions. Other than that, those are staying the same from that standpoint. So just a quick slide on that. And then costs, again, Plain Township picks up a significant portion of the premium. So you can see based on what tier you're in, employee, spouse, employee, children, or family, you can see the total monthly premium and the township's significant contribution, and then your per pay contribution based on what tier you're in for the medical plan. And again, we went over this, some of the new items and changes. We talked about these, changes to the ER visit, copays, things like that. Mental health care, you have that added in, and I believe that no copay for out of outpatient visits. Reminder on your one pass options that's available to you. So again, some additional discounts that you can get. You can pick that up through United Healthcare when there's additional programs. Some additional ways to earn UHC rewards money. Again, same program as last year. You can do the different types of testing. You can take online activities to earn additional dollars, up to that $300 a year in additional rewards money. And again, all of that you can be found at myuhc.com, which probably everybody has an account for already. And the HRA structure, as we talked about in the beginning, you have your wellness that you can get for your 1,000, 2,000, and again, you earn wellness this year for next year as that goes. And then the second portion, you can have the township's HRA pick up after that. And then you, again, can have some of the copays on the pharmacy reimbursed to a certain extent. HRA, again, changed over, I believe, last year over to iSolved. So you have your HRA running through iSolved. And ancillary benefits, same thing through Delta Dental, your vision through the standard, life AD&D through the standard. You have your EAP through Impact Solutions. Again, those are the same as what was in place last year. Delta Dental, just as a reminder, Delta essentially has two networks. They have their PPO network, which is a little more of a narrowed network, and then you have their Premier network, so they're all technically Delta Dental networks, but the discount in the PPO network is greater. So if you have a dentist that's in that PPO network, it's effectively going to take less of your annual benefit because it's a lower cost. So that's where you go to make your money last the furthest or stretch the furthest as far as a standpoint on your annual benefit. Again, you can go to the Premier Dentist networks within Delta Dental Network, but it's going to have slightly less of a discount than their PPO network. And then obviously out of network, you're going to have essentially no discount with regards to that, so it's always good to stay in network whenever you can on the dental side of things. And again, a great benefit provided to you by Plain Township. Anything outside of that, you can still get discounts, although technically it's not covered under your benefit. If you're going with an in-network dentist for teeth whitening and things like that, or even if you've maxed out your benefit, you can still get a discount by going to in-network dentists. Vision, again, another benefit provided to you by Plain Township. No change on any of that. You have your VSP Signature Network, their main network, VSP. Same benefits there. Just some additional there. Again, you can search out the networks on the website for you if you want to see a new doctor or a new place that you want to get some glasses are in network. Again, dental and vision, just some additional information. You can find diseases that might be going on internally, actually through your cleanings and your eye exams, things like that. Life insurance, you have $50,000 provided to eligible members for the township, from the township rather, so a great benefit there. As a reminder, yes.
Sorry to go backwards a little bit with the orthodontics.
Yes.
I couldn't really read it from here, but if my kids have braces, is that, I was under the assumption that we have to pay full for all that stuff. Does Delta Dental help pay for any of that stuff?
So there would be a discount
Okay.
from that sense, but yes, back up.
Number was $1,500 max? Is that what it
So
said?
orthodontist, so lifetime maximum is $1,500. And if you've paid for braces like kids, that doesn't cover a whole lot. But yeah, so it's essentially, it's for each person, it's a $1,500 lifetime maximum.
Okay.
So yes, it would cover a portion of that, a portion of braces.
Okay.
So essentially $1,500.
I'll have to ask Mel, because I'm pretty sure we've been paying full price, just like cash for the braces, so.
So check if they're in network, but they should be pulling that. I mean, since there's a benefit, they should.
And maybe they are, and I just don't know, but I'll have to.
Braces are so expensive, you might not even notice that.
I'm gonna say, yeah.
Okay.
It says the plan pays 60%.
So-
Again, this is something I'm about to run into, so. 60%.
So let's say braces are
So-
$3,000.
Yeah.
So it's gonna pay 60% up to $1,500.
Okay.
So essentially, it's not gonna cover half of that. Well, it would cover it would cover half of that 3,000. So if it was 5,000,
You're getting 15.
you're getting $1,500 because it would be more than that at 60%. So.
Braces are $3,000. I don't know how much it costs.
If braces are $3,000, let me know where you're going,
Yeah,
because
okay.
I'm gonna start using that one. So yeah, so it's a one-time $1,500, and again, that's probably not gonna cover a quarter of it. So it'll pay 60%. So up to, correct. Not just 60% across the board.
That'd be cool.
That would be great. But no, this is actually about the richest benefit we typically see is $1,000. So rarely do you see $1,500. So it's actually a very good benefit, even though we know how expensive braces are. So again, back to the life insurance. Double check. People's life circumstances change, and we've had, unfortunately, seen a couple times this year where we had members of clients pass away, and their beneficiary was still an ex-spouse, and they'd never changed it. So, and they had been remarried. So that was always a interesting situation. That's nothing that we can do. It's nothing that the township can do to change or fix. It's nothing that the carrier can do. The insurance carrier has to follow your designation of a beneficiary, whoever that may be, even if it's technically the wrong person at that time. So good idea to double check who your beneficiary is listed, make sure it's the same person that you want it to be, or your pet, or what have you. Again, additional life insurance. Obviously some of these, like the funeral planning services, you're not gonna care about if you're the one that, unfortunately had something happen. But this is also good to let your partner, your spouse know about, because these are services that they can utilize as well. So it's, if the tables are turned, it's good for you to know it. otherwise, it's good for them to know it as well. So share that with them. These are additional resources that are very helpful, especially in times of need and things like that when they're going on. Again, grief support, legal services. You know, obviously, a person that passes away, they're not going to need the grief support, but their loved ones certainly might. So this is something good that is available, value-added benefits through that life insurance program that you have. Again, if you wanted to pick up additional life insurance, so the voluntary life insurance, you can pick up to $300,000 in increments of $10,000, and you can pick up some for your spouse and children as well. You need to have life insurance yourself before you can pick it up for your spouse. You can't just pick it up for a spouse without having coverage yourself as well.
But also, remember, for your spouse and that up to 300, it's not guaranteed. You still have to do some tests and fill out some medical paperwork, so.
Yes, so unless you were newly hired and this is the first time you're enrolling, you'd have to do what they call evidence of insurability, essentially health background questions. And it'll go through underwriting and then see if they qualify for the additional amount coverages. So things that we talked about, you know, why buy additional life insurance? If you got kids, you gotta pay for college or braces or mortgages if somebody passes away. So again, short-term disability provided to you by Plain Township as well. Begin 14th day of injury or illness, essentially 2 weeks after something happens, your short-term disability would kick in. And we talked about the employee assistance program. You have that available. It's available to you, any of your household members, even if they're not on your plans. Again, any questions, you want to talk to somebody, finances, work, family, relationships, anything like that. It is confidential. It's 24/7. Nobody's getting a list of who's calling in for what. We don't know who calls in. We don't know who utilizes it. So again, it's a great resource, especially in this day and age, to take advantage of. No cost to you, no cost to any of your household members as well. Again, toll-free, 24/7, and you can speak with a counselor. It says 3 health counseling sessions per year. They'll go over that if you need to. So, especially if different events pop up. Just some additional information on the employee assistance program. I know that was rolled out a couple of years ago for you. And again, your wellness program, as a reminder, you have your wellness website that you can go to. And again, if you forgot your password and username, you can get that reset. Utilize the mobile app as well. But again, your wellness program through WellWorks. Again, I know a lot of this is a reminder, but 2027 wellness, so we're already thinking about that for 2026 because it's earned it this year for next year. You have your wellness points equal $1 in HRA wellness funding, and you can earn up to 1,000 or 2,000 based on individual or family. And again, pretty easy to get there. There's a whole list of what you can do to get your wellness points earned throughout the year. And I think everybody has a list for that as well. So I won't go through all these, but obviously preventative care exams, eye visits, things like that. And then using your HRA, as a reminder, you have your 1,000, 2,000 that can be reimbursed through the wellness program for individual or family. Then you have the township's HRA fund that picks up after that. And then again, co-pays on the pharmacy. You can get some of that reimbursed that you would have to submit to iSolved. A little more information here about the eligible expenses. And as a reminder, amounts don't carry over year to year from the benefits. So just a little more information on that. And just a reminder on using your debit card. Obviously you want to save your receipts. Probably some of you have had them come back and ask for some verification on what you used it for. So keep that information. It's not just necessarily, it's not necessarily just the receipt that you paid, but it's more of the more comprehensive information as well. So it's always good to have your explanation of benefits for that service that you went to, and what your bill was after it was run through insurance. And again, the Resource Center for iSolved, as well as your employee portal that you have access to. And all of this, we're updating the benefit guide, so we'll have that available to everybody as well. We can get those printed out and brought over to the firehouse and available for you once those are updated on the 2026 information. And this is a quick run through. Obviously, most of you are familiar with this, but you have your medical expenses, and anytime that you can save yourself money, you're saving the township money. We're able to, through a lot of hard work through the township, and continue keeping costs down as low as possible for everybody. There were a lot of clients we saw this year that were getting increases of 30, 40, and 50%. So yes, healthcare costs are going up, and pharmacy costs are going up, but also what the carriers look at is, okay, what are we taking in the premium that the group is paying us for the services, for the coverage, versus what we're paying out for these services. So in a lot of cases, if it's upside down, where the carrier is paying out $2 in claims for every dollar that they take in premium, that's where you get these big increases happening. But you guys do a great job. Help the township have very, very low renewals for the last 5+ years. So it's nice to have a healthy bunch. Just as a reminder, ways to minimize your costs. Obviously, there's some programs if you can use. I know you have co-pays for your prescriptions, but we've talked about the GoodRx and the OneRx. Those are little apps that you can actually see what the retail cost of your prescriptions are. You can put in your prescription name, whatever that is, dosage amount, your zip code, and you can get the retail cost of that. Not always, but sometimes the retail cost of a prescription will be lower than what your copay is. So you could just run it through an out-of-pocket cost and actually save yourself versus what the copay is. It's not going to be all the time, but especially with some allergy medications and things like that, you can have a lower copay, or excuse me, a lower cost on the retail of the medication than what the copay actually is. And then, as we talked about, not going to the ER unless you have to. So care options. Try to do this every year, but the ER keeps getting more and more expensive. You have your urgent care, obviously a better option to use if you can, versus the ER. I know urgent cares aren't open 24/7 in many cases, and in some cases they don't have the equipment that you'll need. So I've been sent to an ER before because the urgent care didn't have what they needed to check me out with. But also I've used my virtual visit call to say, here's what's going on. Should I go to the emergency room or should I go to the urgent care? Obviously, it wasn't such an emergency that I didn't have time to call, but something like that where maybe you're unsure, you can use some of your other resources to find out if which is the best place to go, not only to save you and yourself the plan money, but also take advantage of what's available from you from a service standpoint. And again, probably everybody has their enrollment already in your portal on UHC, but you can find myuhc.com, you can find providers, and you can look up costs of services, things like that. And again, we'll be getting new cards in the mail because the plan has changed. In the meantime, you keep using your current card. We talked about preventative in the very beginning. Again, online access to care. You have your virtual visits that we just talked about. Those are good things to utilize. Real appeal program, this is still in place. They've had it before. It's not unlike Weight Watchers, if you will, but you get a whole list of goodies shipped to you in the mail. You have a scale, you have a food scale, like a little mini blender, things like that if you're looking to go through the program. They have online coaches, they have forums. All of that is shipped to you for free for members that are going through their Real Appeal program. It's been around for a few years. It's pretty popular. Quit for Life, of course, if you're trying to quit nicotine or smoking tobacco, you have that available to you as well at no cost. So again, quick overview of the program. Not a lot of changes. Some things There's a little slight change that we talked about on your medical plan, just doing away with those co-pays for the most part, and you have your normal deductible and then out-of-pocket max. So, any additional questions from anybody? Thanks a lot.
Thank you.
Just want to do a quick overview. So we tried really hard to keep the cost to our employees down. It's a small increase in your monthly contribution, just because we've had a couple of plan cost increases. But as a concept, employee responsibility is just really prescription copays. All your other out-of-pocket costs are reimbursable to the HRA. The Board of Trustees has continued to pick up those under this plan design, no additional cost for you. If you encounter those when work with you, they're going to be reimbursed by the HRA, so just know that, okay? Also, the mental health care component, we fought really hard to make sure that was an included benefit, no co-pays applied to that. Want to take care of each of you and your families, make sure you use all these benefits available to you. We're working really hard on getting all of our wellness credits in. I think the staff has been doing a good job working with each other. If you know of anyone who's still having trouble, please reach out to Mary or I. We want to get everyone covered for next year. 100% completion is our goal every year.
We're almost there.
And then we usually announce like who has the most wellness points at the end of the year, just for funsies. But there's still time. Make sure you get all your activities in. Any other questions right now that you want to throw up there?
Can we get a copy of that slide presentation?
Yeah, so the slide presentation will go out along with the recording, so
Great.
I encourage you just to listen to the recording and page through the slides. Yep.
Thank you.
When the benefit guide is available, we'll send that out. We send out the benefit summary. As soon as the medical book is available, we'll provide that as well. Again, any changes to your plans, please complete those by the end of next week. Otherwise, if you have other questions, feel free to reach out to Mary or I.
Thank you.
Thanks, everybody.